Good morning, everyone, or good afternoon, or good evening, depending on where you are. My name is Manisha Thomas. I am facilitating today's session on a standardized approach to complaints and feedback mechanisms. The webinar today is on a standardized approach to complaints and feedback mechanisms, and it's the second of 4 sessions organized by the Interagency Standing Committee in collaboration with PHAP during the Humanitarian Networks and Partnerships Weeks in 2022 on accountability to affected populations, or AAP. And we are building these webinars on the discussions that took place in the ISC and PHAP webinars on AAP at the end of last year, the last quarter of last year. And we did have a really engaging conversation around complaints and feedback mechanisms back in the fall sometimes. And I'm really looking forward to today's conversation, just given the importance of standardizing approaches to complaints and feedback sessions. On our first session, which was on Tuesday, and you heard some of the questions that we asked in the Menti poll. So you might have heard that, and anybody who was here on Tuesday noticed that Marcus was wearing the same shirt and had exactly the same script. We were trying to avoid him having him say the same thing 4 times over. But during our session on Tuesday, we were talking about towards collective AAP approaches at country level, and had a great number of experiences that were shared with us from different countries. And one of the examples that came out on Tuesday that really struck me was from Central African Republic, where when they were looking at developing a common system of complaints and feedback mechanisms, they realized that there were 850 different complaints and feedback mechanisms in Central African Republic, which to me is pretty surprising in this day and age, because that's a lot of work for all those organizations to put that many in place, and potentially quite confusing for the individuals who may be using those, trying to figure out whose complaint and feedback mechanism to use, where to go, how to access it can be quite challenging. I think for years we've been talking about why complaints and feedback mechanisms are important as a part of accountability to affected populations. If we're not providing an opportunity for those affected by crises and disasters to really come back and tell us what's working well or what's not working well, we won't be able to adjust our programs or take the necessary steps to address serious complaints. So it is an essential part of how we're doing our responses. And that point that I mentioned earlier about making sure that individuals can just easily find a complaints or feedback mechanism to use without having to figure out which organization is the right one or which complaints mechanism is the correct one. We really need to be doing the work on our end as humanitarian actors to make it as easy as possible. But it's also important that when we design those systems, we do it in consultation with communities so that they are accessible, that they'll use them, so we don't create systems that look good on paper for us, but are not going to be used at all. So it's really a matter of understanding what different mechanisms, different parts of the population or different individuals in the population will use, making sure that it's accessible to diverse groups within a community, whether they're older persons, children, persons with disabilities, marginalized communities, a range of elements that we really need to be thinking about. So today we're going to be looking at, finding ways to have collective feedback and complaints mechanisms and how to standardize them, including in terms of some data standardization initiatives, feedback logbooks and hotlines, as well as initiatives to ensure that the mechanisms are designed so that they are participatory, inclusive, and accessible. We have a great lineup of speakers today who are going to tell us about some of the progress that's being made at the global level, but also hear from them from some country examples today as well. I think also, though, it's going to be an opportunity for all of you to engage as well. And I see that many of you have already introduced yourselves in the chat, which is excellent. If you have not done so, please feel free to introduce yourselves in the chat. We will be, as Marcus mentioned, we will be using the chat. We want to encourage you to provide comments there or questions. We also have the Q&A function that you can use. So please do use that if you want to ask any questions or vote for somebody else's question or even submit a question anonymously. So today, let me introduce our panel before I start asking them some tough questions. We're going to hear today from Charlotte Lancaster, who is Program and Policy Officer with the World Food Program. Welcome, Charlotte. We've also got Eva Erlach, who is CEA. I should have asked what that stands for. Community Engagement and Accountability Delegate, I am guessing. Is that correct?
That's exactly right.
Wonderful, thank you. Sometimes I get my acronyms a little bit mixed up. I apologize. And Eva is with the International Federation of Red Cross and Red Crescent Societies and is joining us from where she's quite busy with the Ukraine response. So we'll have some very up-to-date feedback on how things are working there in terms of feedback and complaints mechanisms. Next, we have Funman Sang, and while you have a photo of him there, he's just getting through passport control, so hopefully he will be able to join us live shortly. Funman is the Director of Capacity Bridging and Technology with the CDAC Network. Next, we have Elda Pereira de Avalar with, again, World Food Program in Mozambique. Elda is the manager of the Linha Verde, and she will be telling us all about that in a little bit as well. We also have Claire O'Reilly, who is a research fellow at Trinity College in Dublin. And last but not least, we have James Macharia, who is the Camp Coordination, Camp Management Cluster Coordinator with UNHCR in Somalia. So welcome to all of you. I'm really excited to hear about what you all have to say. But before I turn to you, I'm just going to turn back to hear what some of those answers were from the Menti poll that we had up in terms of how much people agree with systems. On that first one about, is it important to have a collective complaints mechanism? I'm glad to see that lots agree, 4.6 out of 5. So that's a good majority of the participants today. However, it's not so easy to implement those collective mechanisms. That's at a kind of 1.8, so not even sort of middle of the way. And in my operational context, it is feasible to implement collective complaints and feedback mechanisms. Kind of a midway point there. So I think there's still some work to do in terms of the feasibility of making sure that happens. And I think also understanding what might be some of those barriers to why it's not feasible. And very few say that there are already sufficient collective complaints and feedback mechanisms in their operational context. So I think that really shows that today's session is very appropriate and timely, given that we will be talking about where things are working well and some tools that can help people with implementing and setting up complaints mechanisms and complaints and feedback mechanisms that are collective. I might just start saying CFMs to also save a little bit of time. So there's my acronym for the day, CFMs. Before we get to the panel, I wanted to just make sure that we start off with the second Menti question that we will let you answer as I ask the panelists some questions. So here, select all that apply. Do you regularly face any of the following challenges related to complaints and feedback mechanisms? So trying to understand why many of you said it's not really feasible. It's the 4 options we have there are confidentiality and data privacy concerns make it difficult to share data between agencies. And I see already there's a lot of answers on that one. The second is confidentiality and data privacy concerns make it difficult to act on complaints. The third one is CFM data is insufficiently standardized to allow for reporting and identifying trends. And the last regular challenge potentially is data is inconsistently entered as guidance is lacking or not followed. And I see that we've already got quite a number of high scores for all of those, or a lot of those are the challenges that people are facing. So I think our panel, you've got lots of ways to help solve some challenges that our audience is facing today. Firstly, I'm going to ask you, Charlotte, when we're working across so many diverse contexts, why is it necessary to have common data collection standards?
Yeah, great. Thank you, Manisha. It's a good question, and one that the IAC Results Group 2 on Accountability and Inclusion had to answer last year. And through its co-leading of a sub-work stream within the results group 2, looking at data standards for interagency community feedback mechanisms, WFP and IFRC held a series of consultations, including key informant interviews with more than 30 people from 23 different organizations, and group discussions focused on topics such as inclusion, protection from sexual exploitation and abuse, and looking at a very important qualitative data piece. And through these discussions, we identified 3 common reasons why the collective space needs community feedback data standards. Firstly, we know that community feedback is not sufficiently used to inform action or adapt programming, in part because data is not shared with decision makers in a timely manner or in a format that they can use. And this is in part because of the lack of information management capacity in our relative teams. Secondly, we learned that feedback mechanisms can provide a distorted or incomplete picture of the lived realities of people on the ground. We aim to establish CFMs to increase accountability and to make sure all voices are heard. But if systems are not functional, i.e. if they're not tailored to engaging the hardest to communicate with, then we may inadvertently be decreasing our accountability by amplifying the voices of those who can more easily access the feedback mechanism or processes. And by this, I mean amplifying the voices of those who are closest to us. And of course, this goes against the leaving no one behind agenda. And the third challenge that we identified was a lack of a common and systematic process to capture and then address data throughout the feedback cycle. And without this harmonization, it is likely that we're not referring sensitive cases correctly, nor providing the quality program that we're there to deliver. So although it isn't immediately intuitive, setting standards for collecting, sharing, and actioning feedback data allows us to achieve goals beyond data. We can turn that data into meaningful information that can support decision-making at organizational, but also crucially at that interagency level. And because if we're not doing this, if we're not utilizing those data, and if we're not using common standards to ensure decision makers are using that data, then the question we have to ask is, why are we collecting data at all? Thanks, Manisha.
Thanks, Charlotte. And I think, yeah, that question about, if we're not using it, why collect data is a big one more generally in our community. But I think particularly when it comes to CFMs, because the whole point, as you said, is that we need to adjust our programs and adapt when there are problems. From your perspective, Charlotte, what is a big weakness in our current approach to collective data collection, and what can we do to address that weakness?
Yeah, thanks. I mean, speaking to the point I just made before, and it's something that's not new to discussions such as this, is we've been saying for years that information management really is the backbone of accountability to affected populations, and yet it remains an under-resourced area. We all struggle to recruit those gems that are trained in information management and have that background in protection and or accountability, crucially looking at that community feedback process. And as such, we often collect data without having that analysis plan in place, which means we're collecting data without knowing always how it's going to be utilized to make what decision. So it seems really basic, but we need to flip the process and ask ourselves, who needs to receive what information, in what format, at what time to make what decision? And then we need to work to formulate our questions and to capture data in a way that will allow us to act on it. Another issue that we see compounding this is that senior management involvement in the process is generally weak, but we need their early stage involvement to inform that analysis plan so that we understand how they will use the data or information that we are collecting, the communities are sharing with us. Because once again, if we're not utilizing the data, then really, why are we collecting it all? And so how to address that would be looking at involving senior management in the processes, making sure you have that information management capacity, making sure that a data analysis is in play, and that we are producing reporting products that we can demonstrate is feeding into decision making at that organizational, but also at that collective level. Thank you.
And Charlotte, maybe I could just ask you a quick follow-up to that. I mean, oftentimes I feel we're collecting data because we need to report to donors or headquarters, but is that kind of data that we're collecting for those reporting needs the right ones for decision makers to make those changes that we need to be doing in our programs?
Yeah, I think it's a really good question. maybe not always, perhaps in some, it depends on how your data is being repackaged into that meaningful information that will allow. But I don't see, for example, many HCTs having the discussion saying what it is they need to receive at what stage to make what decision. And of course, that conversation is separate from what donors would like to hear. So I think it is crucial that we take we elevate that conversation so that when we kind of get out of this echo chamber, but have that conversation with the HCTs to develop that analysis plan with them as we move forward. Thanks.
I think that's a really important point, Charlotte, because oftentimes we do tend to work in silos between the CDs that sit on the HCT, those who are collecting the data, those who can analyze it. And I think that point about having those conversations is an important one. Thanks for that, Charlotte. Ava, from your perspective, I know you've been working on a tool that's been developed jointly, a feedback logbook, which is another element in data standardization for CFMs. Can you tell us exactly what does a feedback logbook look like? Although I find it a bit of a tongue twister and I keep writing it down wrong. So, I mean, what does it look like and how can it help us to have more effective CFMs, particularly considering those challenges that Charlotte just raised?
Yeah, thanks so much. And hello again, everyone. And maybe I can share the slide to give you an idea of what this looks like. So this logbook was produced as part of the process that Charlie already mentioned. So that was an effort to better to develop community feedback data standards. And one of the outputs is this Excel sheet. It's so this logbook is provided as an Excel file, and we can see here that it provides the different specific data points that should be captured at different stages of the feedback data cycle. And it shows you how one can record these. So the structure is provided in this template logbook, but it can be integrated or set up using the tools that organizations are using to record community feedback. So some organizations might be using Kobo Collect, using mobile data collection. Others might be recording community feedback data directly into a CRM system, for example, if we have a call center, or other organizations might be using an Excel file for recording community feedback. So this Excel file includes descriptions of the data points that can be or should be recorded, as well as the categories that can be used, and it also includes Hexel hashtags. Hexel is a humanitarian exchange language, and this is a humanitarian data standard that enables interoperability across data sources. So that is included as well. I'm not going too much into detail, and we can move to the next slide. So I can give you an overview of what these different data points are. And I'm remembering now that I can move between the slides myself. So the first data points that I want to touch upon are those that can be documented before or during the data collection. So during that interaction, so there can be location, a feedback channel, the name or the ID of the data collector, and the name of the ID of the data collector is important because it allows for quality assurance. It allows us to go back to the person who actually had this interaction, and it also allows us to provide feedback to the data collector who recorded this information to ensure consistency and high quality process. Then there are also data points that can be that should be recorded during that interaction. So, for example, what I want to point out is the language of the interaction. Often this interaction will take place in local language, but feedback data is often translated on the spot, which is not the ideal case. But often we do not have a good understanding of the language that is used for providing community feedback. Then another important data point I want to highlight is the operational relevance. If we do not know how to best share the relevant data with our sectoral colleagues or different focal points, we risk swamping our colleagues with data that they might not be able to act on. So this is why we highlight this, the importance of tagging the program or the sector that the feedback responds to, so we can, for example, share all the comments that relate to WASH with our WASH colleagues in an easy and efficient way. Then there are also the data points that allow us to triage the feedback comments and to respond to them. So this relates to sensitivity, criticality, and other aspects. So let me highlight the sensitivity of the feedback comment, as there might be comments that come in through any type of channel, and they can put those who share this information or other people related to the comment at risk. So it's essential to tag feedback comments that can be that are sensitive, to ensure that they are immediately saved in a separate database, or that the community feedback form is stored separately and then handed over to the designated focal points. If we don't tag this during this process already, we run the risk of all of the data being mixed up and us not being able to handle the different types of data appropriately and efficiently.
Thanks, Eva. And we've had a number of questions, both in the chat and in the Q&A, as to whether this template can be shared, or can we even attach it, or is it available online now?
It is currently being tested. I actually have to revert this question to Charlie, because I'm currently not involved in this process anymore. But what I do know is that this template was developed. It's now being tested to ensure and tweak, and should be shared widely later this year. But if it can be shared at this point of time, I cannot answer this question, to be honest.
Fair enough. Charlie, are you able to answer that question now, or do you also need a little bit of time to maybe find the answer? And then I'm going to come back to you, Eva.
Yeah, as Eva mentioned, we are currently testing we plan to test the tool in 2022. I will have to just double confirm with the working group. Obviously, it has to be a group decision as to whether it can be shared at this stage.
Wonderful. Maybe there's people in the audience who would be happy to help you test it. So maybe I think there's a lot of keen interest. So if those who are interested maybe can help with the testing process, that would be potentially great. But I will let you figure that out with the working group, and then we will find a way to communicate that back to everyone who's here for sure. Eva, looking at kind of how, let me ask it this way. Given that you're working in the Ukraine response right now, and it is a multi-country response, how can common guiding principles and data standards for CFMs support such a response?
Yeah, thanks, Manish. And yeah, this is a great question, because what we can see, and what has already been mentioned in the scope before, usually we have a lot of different feedback mechanisms that are up and running, and we are trying to get an overview of what the key issues are. So what we are discussing in Ukraine is that there is, as a first step, we need to be able to link community feedback mechanisms and not erase what is already in place, because we have mechanisms that are working well, that are up and running, but that can still be strengthened. So if we have a common understanding of what we are talking about when we talk about community feedback, and if we have these standards that can be provided. So, for example, the data logbook that provides guidance on what data can look like and how you can record it. This can help organizations strengthen what they already have, and it also allows us to come up with a system to look at trends across feedback feedback systems, and also to connect community feedback mechanisms across countries. So if we all use the same way of structuring our data, we can be better able to share this data with other actors who also triangulate data across countries, or potentially even set up systems that work across borders. And there are currently lots of discussions, like, do we want to set up one common mechanism, or do we need to have like a collective approach to ensure that we are harmonizing the way we are recording feedback? And having these standards at hand enables this discussion, because we can then, like, no matter if we are integrating it into the different agency systems, or if we're setting up something new, we already know what it can look like based on best practice, as the logbook that we developed is not something that is new, but it's really based on what has already been used for years by different partners, and we built on that and added a few new things, but generally it's really an overview of what is in place, and like a synthesis of the best practice, as I said. Yeah.
Thanks, Eva. And there are a number of people who would be happy to test the logbook, because Karen from CADE said we have something very similar, so would love to test it. I will email Benjamin. Al Richardson says, at Practical Action, we could be interested in helping to test the tool with you. Hamdi Hassan, I think it might be the same Hamdi that we had on Tuesday. So nice to read you again, Hamdi. We use almost the same logbook. So I think there's a lot of interest out there. And if you are looking for testers, you found a number already, which I think would be great to sort of see where we're going. Maybe Eva, maybe I missed it, and I apologize if I did, because I was trying to keep up with the Q&A and the chat as well. But with that logbook, is it easy enough to pull information to provide it in a manner that is useful for decision makers, that challenge that Charlie was talking about?
Great question. Exactly, that's the purpose of it, right? For us to be better able to share feedback with those that can actually take action. So if we tag the sector, we can easily share it with those that are working on WASH, with those that are working on shelter, but also it enables us to identify overall trends that can that enable us to provide updates in the HCTs, and to do this across agencies, which is the most important thing.
Wonderful. Thanks very much. And I think, yeah, if it's a simple tool, then that we can then translate into something that's understandable for the non-data people, then it's always easier for decisions to be made. Thanks very much, Eva. Before I turn to you, Fanman, I just wanted to look at some of the results from our Menti poll. And here, in terms of those regular challenges, out of 67 people, 67 answers, 50 said that CFM data is insufficiently standardized to allow for reporting and identifying trends as the biggest challenge being faced. So I think this point of the logbook and being able to standardize it is well in the direction of meeting that big challenge. The second challenge is the confidentiality and data privacy concerns make it difficult to share. So I think that one maybe is one that maybe we can tackle a little bit more during the following presentations or during the Q&A. The third biggest challenge from the audience is data is inconsistently entered as guidance is lacking or not followed. And then hopefully the logbook testing will be able to get us to some more guidance around how to use that. Ideally. And then the least biggest challenge, or the not so big a challenge, is confidentiality and data privacy concerns make it difficult to act on complaints. So even though the sharing is difficult because of confidentiality and data privacy concerns, apparently it's not as hard to act on complaints, or it's not as big a barrier, which is good to hear, so that if we can get past those data concerns, we can share them. We are going to have a third question, because it's great. I'm seeing a lot of engagement from the audience, so really appreciate that. So thank you very much. This one, you can just type your answer in. From your perspective, what is needed to make collective CFMs more consistently set up and effective across operations? So we've talked about the challenges, what's working well or not. So what do we need to do to make them more consistently set up and effective across operations? And we'll let you answer that for a bit and come back to it. Next, I'm going to turn to you, Funman, and I'm glad to see that you have made it through passport control and able to join us. As I mentioned, Funman is Director of Capacity Bridging and Technology at the CDAC Network, and has been doing some work around participatory design and AAP multi-sector needs assessments questions. Funman, from your perspective, participation is great in theory, but is it really possible to even ask people who are in the midst of a crisis and are distressed to help design a CFM?
Well, thank you. First of all, I would like to say that apologies, I'm actually not past passport control yet. This is the queue for passport control, so I hope you can hear me. But and I also did the work with Catherine Harris at UNHCR. It was a joint work there. So, but very much so, because the CFM systems have a history of basically not operating as planned, because quite often they are just a cookie cutter imposed approach. There is a sense of urgency. We need to get data immediately, and a system is immediately put in place. And then only afterwards is there the feedback from the feedback is the CSM is not actually working properly. So even in a urgent onset, sudden onset, it's a level of participation is required to see from people, just to see what actually would work immediately. And simple ones that have come across in the past with things like immediately putting in a written-based system during a Rohingya response when the Rohingya language is mainly verbal and doesn't have any written form. So a written response, it took a few weeks, a few months to sort that out. Another one was the same response. Suggestion boxes was realized that afterwards a place too high and for people to reach. It was to do with language issues, again, crop up quite a lot during the Eastern Mediterranean response, and it wasn't realized that there were two different types of dialects going on. And when it comes to electronic channels, I've just flown back from Poland, and which hides in the queue and stuff. And people really are not really working out how systems or what people are communicating there. There's very little communication going on. So I would say the fact that even though it's a sudden onset, it's stressful, a level of participation should always be put in to find out people's preferences. So it's otherwise what we get is poor data. We get incomplete data, and we find out the data we get from certain groups and others, we might marginalize people by not doing this, skews response for the group we can get data for.
Thanks very much, Fatman. And Karen just pointed out to say it's interesting that in the Rohingya response, people are still using suggestion boxes. I mean, and also Ajay noted that we do have to build those strong and effective coordination mechanisms around the process as well. So even I think as we're figuring out what systems would work, it's really important to have coordination so that if one organization figures out it's a good system, that they share that information with others, so others are not having to ask the same questions, perhaps. Maybe moving to another question for you, Funman. As some aid providers may not know where to start with designing a CFM, if you wanted to increase participation, and I understand I was going to say, why didn't you create sort of a new tool around this to help people create CFMs? And apparently I understand you were even against creating a new tool on this. Why is that?
Well, I mean, during this work we did, Catherine and I basically asked the CFM working group to suggest what was actually needed. And first thing we said was, send us the tools that work for you. And pretty soon our inboxes were overwhelmed with tools that work. Having tools that work is not a problem. I don't think there is. I mean, this hasn't been published yet, but we basically end up with a huge list of tools that work, and everybody was telling us, use our tool, use this tool, this tool. If everybody worked around this tool, then and we collated that now we can have a common tool. And what happened was we found out there were at least 15 or 20 common tools. They were not very common to each other, and then they were all great. And then there was also even greater marginalized people, especially in the PSEA area. This is great sort of like specialist tools as well, and children's specialist tools as well. So what we've all realized was it's not the tools of the issue. The issue we had was people knowing how to navigate them, especially the non-specialists. a lot of these tools sit in specialist parts of the website. They sit in specialist areas of work. I work in the AAP CCEA area, so I talk to my colleagues in this, and we all know this. But the issue we have to reach out to is, of course, the people working in shelter who might not know this. People working in NFIs who don't know this. We keep people working in relocation. There's so many other departments. And I remember working with people who work environment who absolutely have no idea. Literally said, "Where do we even start with this?" And it's what we want to do was give advice, and instead of tools, we want to give strong guidance. And it goes around of things to consider, and then signposting and directing people to the appropriate tool. I mean, I think we need to really stop with the let's invent something new. Solution is something new. There seems to be an inbuilt drive towards innovation, and what we end up with is variations, slight variations of what already exists, which again adds to the incompatibility factor, again to the duplication factor, and again to add to how do we harmonize if everybody's working slightly differently. And what we need is what we said was guidance on how to increase participation. We built up some these questions that could stand alone. They can ask people. One of the reasons why we end up using the MSNA was the MSNA happens anyway. It's like building on what it is before. It's very important to see what is already working before and build upon it, and then work towards convening it to come together, rather than someone standing up and saying, "Here's a new one," and we did not want to add to that. And so a lot of this comes from the need to see what works and build into it. And the MSNAs already was there. We built it into that. But we also made a modular adaptable, so if you want to take it out, and you can use it as a focus group. Because the other thing is with the tools is this idea that one thing is what we need. And because all people are different, all groups are different, what we actually need, which is very apparent for me from the many different groups arriving around me right now at this airport, but every group's different. Everybody thinks back differently. I can hear multitudes of languages here. And I don't know if you can hear, but right now there has been a Ukrainian relocation flight coming, and British officials try to find Ukrainian people to resettle. And this is all happening around me right now. And there are 3 different systems happening here. And we need to be flexible enough to find out how to get them to work together. And that's why we were against the idea of a new tool. And instead build what we can, collect it together, and give them what people mainly need is advice and signposting to how to do that. And that's what we ended up working on, strong guidance on that.
Wonderful. And I think that resonates really well with me, because I feel that oftentimes, as you said, in our sector, we just throw a new tool at something when we feel we don't know what the answer is. It's like, oh, here's some more tools for you. So I think the way that you've incorporated it into the MSNA to make it easier for non-specialists is also critical, because I think otherwise, if it becomes too specialized, people aren't going to use that. Fadman, you said that list of resources hasn't been published yet. When is the plan to get that out?
I don't know. It's being processed at the moment, so I don't know exactly what is. But on the other hand, I would encourage people that it is basically pulling together what exists, and I would say the fact that we can share some of those resources that are listed to give people. But really, I would say most organisations have it. ISCA platform has it. UNHCR has it. CDAC has it. These are just 3 people who are involved in this, and we all have our little portals, and so does everybody else. And so that's what we were saying was that, but the advice itself, we'll hopefully get that out soon. Yes. But as you said about the language, I can't emphasize enough is that fact that, especially non-specialist NGOs meeting this space for the first time, working again, coming where I've just come from, even the concepts of words protection and accountability are unknown to some people working and what they truly mean. So we throw these words around without knowing the fact that not everybody understands the technical meaning of these words.
Absolutely. And there's a question that just came in sort of, when we talk about collective CFM, what does that imply actually?
Well, this implies the fact that people imply just collective CFM is better by saying it's collective CFM working together in harmony. It's the case of the collective channels working together, collective ways of doing, and then working out ways to harmonize that. A collective CFM should not be one CFM that does everything. A does everything tool usually doesn't do anything. That's the problem. Something that is almost like saying, I like to be anywhere, then you're already there. A collective CFM does everything. It has to be so bureaucratic that it's not unworkable, or it's so general, it doesn't give anything useful generally.
Super. Thanks, Funman. And I'm going to let you hopefully get through passport control relatively soon so you can answer some questions after that. But I am going to turn over to Elda with WFP in Mozambique, where Elda is managing the Linha Verde for an example of a collective CFM. And there's obviously other collective CFMs that are being complaints and feedback mechanisms that are being used, such as AWAZ, the call center in Afghanistan. And I'm sure that there's other ones, and really do invite you to put things in the chat. And I know a lot of you are already sharing a lot of examples, and I'm not going to read them all just because we won't have time to get to the questions and get through all our panelists. But I'm really grateful for all of you for sharing your experiences. So please keep doing that. But Elda, if I may, what challenges did you face when you were setting up Linha Verde to ensure the link between data classification and programmatic action at either the agency or collective level? And maybe you could talk a little bit about what Linha Verde is, since I didn't explain it very well.
As you mentioned, Linha Verde is the Mozambican interagency complaints and feedback mechanism established as a result of WIDI, and then has scaled up to the north of the country, the situation in the north of the country. So being interagency means that it responds to various issues covering the interventions related to the various sectors responding to the crisis in the north. So getting right to your question, I think in the beginning, we learned that the data had to speak to what was happening on the ground. You know, we had to interact with the different sectors to understand how best to label issues so they would not go unnoticed and have the correct effect and the correct impact and consequent action from their side. So it was not just us sitting in a room and coming up with categories or ways to label issues, but it was to understand to them, like, if we present this type of issue to you, will it make sense? You know, will it drive, you know, how would this issue drive you to action? You know, because, and we had to give concrete examples of the issues that were, the concerns that were being raised, and ensure that they would fully understand these with relevance to their programs, and consequently drive the action. And it's important to also mention that, you know, our tool was, you know, had to respond to the needs. What we imagined our tool had to be was one thing. What we imagined the needs were in the community, and for the feedback loop to drive through the feedback loop was one thing. But when we implemented it, when we tested it and implemented it, I think that looking at how it responded to these needs was also very important, and showed us how we needed to interact, that we needed to interact more, that we needed to ask more questions, that we needed to actually respond to the needs for the tool to be useful.
Super, thanks. And how is it working now? And are there any challenges that you still have to address?
Definitely, most certainly. I think the fact that it's a mechanism shared amongst various sectors involves an adaptation to the different sectorial needs and situations that arise. And it took a bit of work to clarify to the different sectors how the hotline works in the first place, where they come in, what their role is, ensuring that we communicate that awareness raising is across the board and it involves everyone at community level, and using the various channels of awareness raising. Information provision on interventions also depends on them, and not just us, you know, us obviously communicating what information is necessary, what information is being looked for, but also them providing this information to us is very important. That the feedback provision involves awareness and communication of the actions that they have taken. You know, I think that this is very important. So sometimes they receive this information, they receive the concerns, they take the actions, and then you know, there's this gap in receiving the information on what actions they've taken. So we've had to demonstrate using examples from actors who've taken action and who've provided feedback, and to demonstrate this and document this in our reporting to just show that this is demonstrable and this is what feedback looks like if they communicate to us. So make it realistic and making it more tangible. And yeah, tangible to the different sectors in their own specified ways. So I think that that's been very important for us. I think in a sustainability perspective, it's been very helpful to see the continued contribution from the different sectors and the different agencies. So this has helped cement the collective ownership, of the service, and it has helped us to explain the benefit of beneficiary feedback as a collective, how it can impact the different programs, how it can be beneficial to the different programs.
Super interesting. Thanks very much, Elda. I mean, I saw a comment, and there's so many coming in. Somebody was noting that you should have multiple accessible feedback channels, because some of which will be appropriate for hearing sensitive complaints. I mean, when you were setting it up, I mean, did you have that conversation about which channels would be most appropriate for sensitive complaints versus general feedback? How did you make those distinctions?
I think that as time has gone, we have understood that, the hotline service is not the end all and be all, and it's not the best. It's not always and in every situation the best CFM. We've had IOM come in and set up a community-based complaints and feedback mechanism, and this is in the resettlement sites where they have presence. And I think that this has been helpful for us to link ourselves to, because them having presence in the community is something that we don't have. Physical presence is something that we don't have. And this bridges the gap, I think, for vulnerable groups. Access to CFMs for the most vulnerable groups. We have, there's certain lack of access to phones and electricity and things like that we cannot solve as a CFM. As a hotline service, just to be specific. So there's the community-based complaints and feedback mechanisms, and there are different ways by way of agency focal points or help desks. It's important for us as a hotline to link ourselves to these, because it helps. It's actually for the benefit of the community. In the end, it's how best do we hear from them. How best do we protect them? When we try to hear from them. So it's been us leaving ourselves open to this as a CFM and linking ourselves to what is already there and what is in the community to ensure that feedback is provided, to ensure that the voices are heard.
Super. Thanks very much for that, Elda. I'm going to turn to Claire, and I know we still have lots of questions, but we will have time to come to them after we let our panelists answer the first round of questions that they're prepared for, and then they can think about some of those questions in the Q&A. And for all the panelists, if there are any that you feel that you can answer just by typing an answer, please feel free to do that while we're going through the questions beforehand. Claire, I know you're a research fellow at Trinity College, and you've got experience around designing for inclusion and accessibility. So from your experience, how best can you ensure that feedback processes and mechanisms are accessible to those that are most at risk of being left behind? That point that Charlie made earlier is that we need to be careful not to leave anyone behind. And how best can you ensure that the information collected through feedback processes can be used to support the inclusiveness of the programmatic response?
Yeah, great. Thank you very much for those questions. I've really been enjoying listening to also the event on Tuesday, and great to hear that inclusion, disability and inclusion are considerations when we're talking about AAP processes and mechanisms. So let me keep this answer really practical, because I think sometimes people get quite overwhelmed when they're already thinking about CFM, bringing the data people, bringing the program people, bringing the protection people together, and inclusion is then one additional thing to think about. So what I'll say is that when we're thinking about ensuring that these processes are accessible to people who are most at risk of being left behind, that should really be our starting point. It shouldn't be an add-on. So it's not that we design our CFM or our channels and then we think about, okay, who's going to have difficulty reaching these and what will we do about it? But instead, I think when we're visualizing that end user, that we're thinking about the people who are experiencing different risks, different barriers, different challenges. And if we are starting at that point and designing for the margins, then we're reaching back to those furthest behind and considering not leaving them out in terms of what we're doing. And so I think there's some practical things that people are already really familiar with, consulting with local representative groups and getting an understanding of how different groups like to receive their information and ensuring that the different channels are available. I'll give an example from Moldova and WFP's CFM there that I've just been looking at recently. And what was coming through in the data when we looked at the age disaggregation, and they have quite granular age disaggregation there, so we were able to really drill down into the details, is it's giving us an indication of who is finding out about the CFM and these processes through different mechanisms. And so it was clear that people from around the age of 50 and up, they're not getting their information from Facebook. They're not getting their information from the websites that a lot of others are. They're getting their information through word of mouth. And so then to link that to how do we make programming accessible, started to think through looking at those demographic factors, who's getting their information how, and how do we tailor ourselves to that? So I was in Mozambique earlier this year. I was in the north of the country, so unfortunately didn't get to meet Elda face-to-face in Maputo. But they were using some of the information that was coming through to really get out ahead of this and be responsive in terms of turning some of that community information into accessible programming. So they knew they had a change in a targeting approach coming up, and they wanted to share that information with the community to decrease tensions, to increase acceptance and understanding. And so what we did was we closed the loop essentially. So not only looking at CFMs as a way for people to come to the organization and ask for information, but also thinking about, okay, how are we proactively providing information to people? And so we designed communication supports. They're initially designed with people with communication disabilities in mind. So really accessible, using simple language, using bolding, using simple images. And we made those available in 5 languages. And it goes back to my first point. This was the user who's going to have the most trouble accessing information is going to be a person with a communication disability, speaking a minority language. But what we found across the board for women with low literacy, and there's very low literacy rates for women, even versus men in Mozambique, for really language diverse contexts, having this information available and thinking about accessibility as your starting point was really a benefit for everybody. Another thing to think about is when we were comparing the data from the CFMs through Syria versus Moldova and the Ukraine. So you're really comparing a very, I suppose we can say, mature crisis to a more acute situation. And what we see coming through in terms of those categorizations of the request types or the feedback types coming in Moldova, it's acute, it's new. It was about 92% of people looking for information. How do I get registered? What do I do? Who do I contact? So again, thinking about, okay, who's asking for information? Where do they tend to get that information from? Where do they find out about this number? And then how do we start proactively putting information out through that? Versus in Syria, what we saw a lot more, the more mature crisis, it was requests around, okay, I've been assessed a couple of months ago. What's going to happen next? It's more around timelines. It's more around requests that maybe WFP couldn't meet, looking for blankets, NFIs, and so on. So you start to see there again, these kind of spillover inclusion benefits of the potential for having interagency and this collaborative approach where you can more readily share cases and information. So I think those are probably the top line pieces that I would think really communicate with the community to understand what their preferences are, but don't discount the ability of proper demographic disaggregation in your data to then give you information about who's maybe getting left behind, who's going to be experiencing risks, who's struggling to get information. And depending on the type or the phase of the crisis or the response that you're in, really looking at that over time. So it may be that needs change over time, but it's also very likely that people who are at the margins, people who are at risk of getting left behind, women or persons with disabilities, as things mature, they might start to experience different risks. And if you have an eye to that, if you have that sort of inclusion lens when you're looking at your CFM data, for example, you can start to get an indication of that. So a final example that I'll give you, in Moldova, they had open data fields. And so collecting open qualitative data in the early phases to essentially get at unknown unknowns. You know, what are people speaking about that maybe isn't already in our pre-existing categories or in those drop downs? And so that allowed us to see, okay, one of the main barriers to access at the moment is for older people. That wasn't in a drop down category, but they were able to capture it. So we added to the drop down. Now the process is more streamlined. The process is faster. It's turning that data into actionable information more rapidly. And then over time, you can monitor that other category. So if other is 3% of your responses today, but in 6 months, it's 8%. It's like, okay, what's the new issue that we're not capturing here in our drop downs? What is this other? And then you can think about, well, who's it coming from? Let's go and do a focus group discussion with these people, or let's speak to our operators. And in that way, I think you're not making the process too heavy in terms of data collection that is not going to get analyzed or translated information, but you are sort of giving people markers around where might marginalization be hiding, where might people be falling through the cracks, and what are the early warnings of that in our data system. I'll stop there.
Thanks very much, Claire. And I think that point about really using that data that you're collecting, particularly when it's disaggregated, to understand what the different barriers may be is really important. And, you know, again, it's like we should be collecting data in order to use it to be able to change our programs to improve it. I mean, I've got a question for you around sort of how best can we measure the inclusiveness of a feedback process or mechanism, but I'm going to tie that also to a question that Don wrote about how do we measure the effectiveness of the mechanism so that they can be relevant and up to date. So inclusive and effective.
Yes, inclusive and effective and measurement.
Yeah.
And I'm gonna talk on the measurement one because the focus of my research is looking at disability inclusion in humanitarian programming with a focus on accountability to affected populations at the moment. But one of the things that we looked at through different CFM mechanisms that WFP has in place across different offices was around this. How are we measuring who it's inclusive to, and can we ensure that people with disabilities are accessing? And so different country offices took different approaches. So we used the Washington Group questions, which are used for disaggregating the disability. Ava spoke to them and people might be familiar. And quite frankly, they didn't work in that context. They took a long time and there was a small charge for calling, so people were hanging up before they were really getting to the main reason why they were calling. So already that's raising feasibility, but also do no harm concerns. And people also had questions back in terms of, why are you asking me these? So it comes back to, again, having that analysis plan in place before you collect your data and thinking about the purpose. And so when we went back to the purpose of, okay, well, why do we want to have this data? Maybe the Washington Group weren't the most useful. And we went to, let's see if we can tag. Another country office in Syria tried to tag if people self-declared that the call was related to disability in some way. You know, I've been left off the lists, but I'm very vulnerable because I have a disabled child. And what that ended up doing was that we were able to measure how many calls were related to disability, but we weren't producing actionable information. What we could do was we could report on that to a donor or on paper, but what did it tell us about why the program was missing these people, or whether, you know, the type of programming or the targeting criteria needed to be changed? That information wasn't there. And so now what we are seeing in Moldova, and what you'll have seen in the logbook shared by Ava, is this question around, are you calling on your own behalf or on the behalf of someone else? And this, I think, is starting to give us really useful information. That was about 1 in 5 calls in Moldova. And so then we start to get at, okay, is the other person calling because maybe they don't have a smartphone? You know, why do they not have a smartphone? Is that financial? Is that digital literacy issues? Is it because they're a person with a disability and it's not accessible to them? Are you in a context where the other person is a woman and so it's not appropriate for her to call a phone, you know, not knowing who might answer? And so thinking about really, when we're measuring inclusivity, definitely broadening it beyond just one particular group or one kind of tick box approach in terms of our data, but to what's the understanding that we're trying to get at here? What does it mean if our processes aren't inclusive? Who's getting left out? And I think that starts to give some indications around sort of where in this data you can find it inside the streamlined process, not trying to add to the burden of data collection, but really enriching that analysis by putting these lenses on it. And I might have missed the second part of your question. It's gone out of my head now. So feel free to remind me.
It was around how do you measure the effectiveness and the inclusion
of inclusion in these?
Yeah, of the measure.
Yeah.
Yeah. So I think you got that.
Yeah, I think, again, I mean, I think this is always going to be a little bit tricky to measure because, of course, you can't ask the people who call you up on a hotline who's not calling me on the hotline, so there's always going to be a bias there in terms of who you're missing. But I think that goes back to what have been common threads to what I'm saying, and I think what others are saying as well, is first consult with the community, understand maybe who's going to be at risk of not being able to contact you or not being able to get information. Think about what are the different channels that you're going to have available. Close the loop on those channels in terms of providing information to people in a way they can access about how to get in contact, be that multiple language formats, be that thinking about Facebook, but also perhaps training up trusted word of mouth message carriers in different communities. And so there's an element of, at least that if you get the design right and that inclusion is embedded in that leaving no one behind approach from the start, that it is maximally accessible. And then you can come back to your data and you can look at these demographic pieces and you can see who's contacting us, who's not contacting us as you look at the demographics then of your crisis. Obviously, for example, in Moldova, we're not expecting to see a lot of men under the age of 60 because of the restrictions on them leaving the country. So once you understand that you have designed it to be accessible to as many as possible, that you understand why you are collecting the data that you are, then you can look at it with that lens in the context that you're in and start to get some indications and perhaps go back to the community when you start to suspect that there might be gaps or people who are being marginalized despite these efforts.
Super, thanks very much, Claire. And just looking, we have lots of great answers to some of the questions that have been posed in the Q&A, and we will be able to leave the room open. So if anybody hasn't been able to look through the Q&A, you can do that. And I know somebody had asked if you can save the chat because there's also lots of great conversations and questions coming up there. Lots of debate around the use of suggestion boxes and whether that's the right thing to do. Some are surprised that it's being used, and others are saying it's used in combination with other mechanisms for complaints and feedbacks. But also others pointing out that maybe we should be calling them complaints, feedback, and response mechanisms so that we don't just collect the complaints and feedback, but then not respond. So maybe we need to do a bit of a rebranding. And someone also talked about the need to decolonize the system because we've been talking about the need to collect feedback and respond to it, but we're still not there yet. There were also some kind of questions around, are there good examples of CFMs or collective mechanisms or somewhere that people can go? And I know some people have shared some good examples, but maybe, because I'm going to come to you, James, in a second, maybe you've got some good examples as well. But thank you, Claire, for those. James, I mean, how have feedback and complaints mechanisms been set up in Somalia where you're working? And what have been some of the challenges that you've had to overcome?
Yeah, I hope you can hear me, Manisha. So great. Thank you very much, and thanks for having us. The feedback mechanism in Somalia was set up from 2020, July. And since then, we have been collecting data related to complaint and feedback response. And we have been able to collect it through different channels. One of the channels is, if I may divide them into two, one is static and one is mobile. The static one is done through the information desks that are at the site level, where CCM partners are working, as well as like community centers or even at CCCM partners' offices. Then there is the mobile teams who were able to reach out to different sites or different points of the site where probably someone, for example, living with disability will not be able to go, as well as someone who is sick may not be able to access. So the mobile teams come in there to bridge the gap of those people who may not have access. There is also the hotlines, and this also helps to promote confidentiality, but also as well as people who may not be able to get to the information desk, but they have maybe some phone and they have a way of reaching out, or they can ask a friend who can help them to call. So those are the main 3 channels that we normally have focused on. It's very much community site level based. We have the staff who are collecting data, and then on when all this data is collected, it's collected either through recording paperwork and then uploaded to Kobo, and we have a live dashboard that we are able to put on online, and everyone can see the different categories. I was going to try and present just the first page of the dashboard. I'm trying to see which. Let me just see. Yeah, there you go. I hope you'll be able to see it when I share, so that I can be able to explain just a little bit on how it's been working. Just confirm if you can see the screen.
Yep, I can. Thanks, James.
Great. So this is how, at the end result of what we have been able to collect from the community level to our partners. At the end of the result is normally like this. You'll be able to see the feedback. I mean, the complaints that have been collected. How many people have submitted who are living with disability? How many sites we've collected this from, and the districts. It's a kind of a snapshot summary of what information we have been able to collect. And then on top of that, you can be able to see the sex, or that is male or female in terms of percentage, as well as what we've been able to close and what is still open now. What I didn't mention is that we normally have like a 2-week window whereby we give that as a process for closing the feedback loop. So in case that we've not had any feedback, or the loop is not closed, so that case or complaint continues to be open. But in case you've had conclusive feedback and you're able to close, then you record it as closed. So this is normally more or less the summary. And then on top of that, you can be able to see the top districts, for example, which have on the left-hand side, if you can see my screen, you're able to see the top districts that have most complaints, where they're coming from, as well as, for example, the sectors. So in this case, for example, I just filtered for the month of April what we've been able to receive, and you can see the highest are in food security, shelter, wash, and the list continues like that. On this other summary here, you're able to see a little bit of comments on what people are saying. If it's food, you'll find maybe they're giving some of the reasons. It's because of the drought, or they've not had any assistance, or in case of health, they're able to put some comments or be able to capture some comments. Maybe there is no health facilities in this place, and so we don't have access to health, and so on and so forth. On top of that, what we've done as a cluster, that is the CCCM cluster, is that we normally have also a dashboard that summarizes this into a pager that we're able to share with our in other clusters. So the pager normally summarizes all the issues that have been received in the month. I'm going to try and just show you an example of that pager, how it looks like. And that's, if you can see, Manisha, just confirm. Great. So the pager normally as well summarizes different sectors and different issues, and this helps the other clusters to be able to see what is coming from the community and where the gaps are. I know maybe the font is very small on this. I just wanted to demonstrate it. And then we have like the district breakdown, the sex breakdown, so that you're able to see how many people or people with disability, how many of them have been raised complaints, and so on and so forth. So this is just to make use of the data and make it more friendly and interactive and more usable to the clusters. And what this has done as well is to engage or to have like a sort of follow-up that you engage in conversation with the other clusters where you need to follow up. As you saw, for example, in this case, food security and wash and shelter are like some of the highest complaints that we received. Then you can even have that bilateral discussion with different clusters. And so that's more or less how we've been able to work on the CFM data. And also we have been able to look at comparisons based on the fact that we're able to do this analysis and trends. We're able to compare, for example, with other tools like the service monitoring tool. And you see like there is an interrelation, a correlation between these two tools, whereby you find if, for example, the community is complaining so much, I mean, the complaints that are coming from the community are very much dealing with food or wash or shelter, and you compare that to, for example, site monitoring, service monitoring tool, and what we summarize because we have a similar kind of initiative, then you find that they are kind of talking to each other, where the community is saying and where the services availability are, there is a direct correlation with that. So in a nutshell, that is how it's been working in Somalia with regard to CFM.
Thanks very much, James. And I'm going to have you look at the chat box because someone was interested in keen on learning how they could learn from you for, I think it was the child safeguarding, for the global education cluster. They'd like to learn from you. So I think that's really helpful. I mean, James, from your perspective, are there any lessons that you identified in sort of setting up the CFM in Somalia that you want others to learn from so they don't make any of the same mistakes or encounter the same challenges that you did?
Yeah. So thank you, Manisha. Yes, definitely. There's some lessons that we could share. One of them is that CFM is one of those activities that is labor intensive if you want to do it right. So you have to invest resources, especially when it comes to presence. And one point that, for example, we've noted, if I might just use that as an example based linked to the lessons learned, is you find you can be able to follow even when you see the numbers are going low, then you're able to ask what are the reasons that we have not received as many complaints compared to the other month. And for example, one of the things that we learned was that we did not have enough like community structures where people can go to share their concerns. So you find that you need resources to set up those, let's say, information desks to be able for people to have access to that, because actually majority of people prefer in-person kind of concerns, going to raise for their concerns through visiting the information desk or going to the community center where the CFM person, focal person, and so on and so forth. So resources are key, and setting up those structures that people will have access to share the information or their concerns. And number two is in terms of response. You find that is one of the weakness that takes time, and some causes maybe people not to keep on raising the same issue. If it's issues to do with water, or if it's issues to do with shelter and hasn't been addressed, then you find people will be less and less inclined to be reporting. The other lesson learned is awareness. People need to be aware of how these different channels of information are working, and as much as possible, share with them the feedback. And we're able to share even like this kind of summary reports with the community, just to see that the advocacy part of what they're sharing is reaching other clusters, reaching other people and other agencies who are providing services. So they need to be aware of the channels that they're able to report any concerns. And one of that requires like massive, awareness sessions. We have a bit of radio programming where you can talk about this. We have even like people who are mobile with megaphones who will talk about the CFM to make sure that people are aware of how they can share some of their concerns. And then from there, of course, as you've seen, I think it's very important to kind of make the information as I don't remember the first speaker who said about making this information actionable. So summarizing the data in a way that is palatable to other people. So, for example, if we shared with you the Excel sheet, you will not make any sense out of it. But when you see these summaries at the end of it, at the front end on an online dashboard like this, and when you see just one page which is talking about CFM, then you will have time to at least look at it and go through it. So those are some of the lessons that we could share from Somalia.
Thanks very much, James. And there's definitely people who are interested in having maybe access to that. So if you can easily drop that link into the chat, that would be great. I wanted to turn to some of the questions that we've got here before I turn to the Menti and then last words, because I see that we're running up on time and there's been so much great stuff that's been coming out. as I mentioned, there have been a lot of questions answered by colleagues in the room, or in the virtual room. So thanks very much for that. But there's a couple here that I thought would be interesting to get your perspectives on. I mean, this issue about feedback being oral, that some of it is very sort of in oral societies. How can we make sure that we are able to capture that? I mean, it's a bit that informal feedback that you were talking about, James, whether it's at a desk or in a more confidential place, as somebody pointed out, is that sometimes, an open desk is not where someone who, for example, has experienced gender-based violence is going to come and make a complaint, or sexual exploitation is going to come and talk about that. So also finding sort of those confidential spaces. But if there's any other thoughts around what should we be doing in terms of collecting that oral feedback, and then also in terms of some cultural practices that might impact or interfere with feedback mechanisms, what's a good way for conducting community sensitization? And I'm assuming that part of it would be, involving the community in designing the complaints and feedback mechanism in the first place. But maybe if others have thoughts around that. There had also been some questions around, making sure that there's child-specific CFMs, and wondered if any of you on the panel might have any thoughts around that. And then also in terms of, is there a place where good CFMs are presented that people can go look at for examples, even how you design those in consultation with communities? That's a lot of questions there. So maybe I'll stop there and see if any of you want to come in there. Charlie and Bunman, I see you putting your hands up. Oh, and Ava. Charlie, I saw you first. Do you want to go first, or?
Perhaps I can. I think there's been a lot of interesting questions posed in the chat there. So thanks everyone for being engaged. I think a lot of it comes down to the functionality of your system. So I've seen some questions around the title, whether it's age appropriate, whatnot. WFP, what we're really focusing on is the functionality of the system, of the process. So we have minimum standards that if we can meet, we are fairly certain that our system is being functional. And by default, that means you are responding to feedback. It means that children can access your system. It means it is inclusive. And so we have a monitoring framework to measure our progress against that functionality. And I think what we have to look at the HCT level is the AAP maturity of that interagency coordination there. To what extent are they willing to be independently monitored, as Stein has mentioned as well. And also just to flag, there's an opportunity with the sort of the new structure of the IASC to look into how we can bring in or introduce some of the systematic changes that are required to really ensure that we are accountable. The Task Force 2 on accountability to affected populations, the IASC Task Force 2 on accountability to affected populations, co-led by WFP, IFRC and CHS Alliance, will be reviewing its work plan for the 2022-2023 period. There's an opportunity there to see, for example, how these country level action plans that will be reviewed as a recommendation can really influence that centralized accountability piece, as Stein mentioned, looking at that independent monitoring, how we can measure the effectiveness of our approach, how well we are responding, and ensure that the voices of affected populations are not only included in the design of the mechanism, but also in its evaluation and monitoring as we move forward. So I know there was a lot of questions you raised, but hopefully that may have hit on a few of them. Over to others. Thank you.
Thanks, Charlie. And I think you also raised a point that had come up in the chat around how sometimes data will be sort of cleaned. Somebody compared it to like selling ice cream at a very bland level. And how do we make sure that agencies are not kind of, clearing out the sensitive stuff of data if it requires a response? So maybe somebody can take that. Ava, I'd seen your hand up.
Yeah, thanks, Manisha. And yeah, absolutely. I actually wanted to come in when about like the recording of verbal feedback, but just to to also respond to the question about like how to ensure that we are not cleaning out the data. This is why it's so important to have a common understanding of what community feedback is and what is sensitive and what is non-sensitive, to have clear processes and agreed upon processes on how to share, on how to identify sensitive cases, keep these safe, and agree on how this is shared, how this is referred to the right systems, making sure that our feedback mechanisms are connected, because we know that feedback will come in through any kind of channel, and we always need to be prepared for sensitive feedback. And this is also why it's so important to record verbal feedback, because this is such an important feedback channel. And sometimes we are thinking of new fancy solutions because it's sometimes also easier to set up a chatbot or a digital solution, which is of course important. But our staff and volunteers are already in regular contact with community members, so we need to find ways so that staff and volunteers know about the importance of community feedback and know how to capture this. The Red Cross and other organizations have done a lot of work on this, so there are a lot of tools available that can help you train your staff and volunteers on what community feedback is and how to capture this. So there will also be a new IPC feedback kit be published soon, and I'll also drop a link to other Red Cross tools that provide simple tools for how to capture verbal feedback. But just to emphasize that it's critical to find ways to harvest what our staff and volunteers are already doing, because there's often a lot of information that is not systematically collected and used. Thank you.
Thanks very much, Ava. I've got Funman and James, and maybe I can ask you both just to also, if you have any final words, and then I'll do the round back to Elda, Ava, Claire, and Charlie, if you have any last words before I wrap up. Funman, please.
Yes, I was also one to mention about the verbal feedback area, which is interesting because we often say about the point of CFMs is to hear people's voices. But the system we have is not about people's voices at all. It's about people's writing. It's because all our data is about being written down, being shared in written forms on email and sheets. And it's almost a case of retrofitting audio back into it, which should be actually, instead of, this is where the preferences comes in. If there is a John's preference for audio feedback, the starting point shouldn't be we have a CFM that's based on written data and written text, and how do we retrofit it back? Because I almost like thinking from the ground up. I mean, as an example, which is interesting, there was, I think, during our work, we did, I think Save the Children did an interesting one where all feedback was collected on audio formats initially, and staffing was then reorientated to have people to analyze them. And that was kept anonymity quite high, partly because the people doing the analyzing quite often didn't know who's the talking, but they could analyze that and you get disaggregated data. But the whole system was based on, okay, we're doing audio feedback first. We're doing audio-led first. Other examples would be the fact that talk about digital media, people on digital, but people can't read. Actually, a lot of people use digital formatting because it's audio talking. All messages are audio. People are sending audio messages to each other and using symbolic pictograms. Of course, that's not being used because a lot of when it's digital sharing is based on words and text. So this is where actually analyzing preferences really comes in, and having that, we're doing it. And do you think we're building from that point onwards? And my final thought about that quite often is about when we're finding out, looking gaps and talking what people need and having open conversation, people speak freely is important. There was a couple of times places I worked, especially in Syria and in South Sudan, there was high levels of suicide amongst single men. And one of the things was the fact that because so much effort had been based on marginalized people, the group that ended up being marginalized into surveying, if not in numbers, was single young men. Because there were so many of them, they were not possibly marginalized. So what we realized were the problems underneath was when suicide rates lifted, which is the worst possible way of getting feedback. So I would say it's the fact that, which is again, it's kind of, but again, switching to open talking. So not drop downs, but an open system of multiple systems, designing multiple audio spoken free speaking systems was the way going forwards. And that's what the systems of systems is what to look at. and disaggregating it and approaching it from effectively a user level first, rather than a data analysis level first.
Absolutely. It's putting people at the center very much and looking at what their preferences are. I realize we've got 3 minutes left. So James, Elda, Claire, I'm going to ask you to be quite quick in your response in your final words, if I may, because we've got a few other things to cover. Please, James.
Thanks, Manisha. Thanks a lot. And just wanted to weigh in terms of just one more point in terms of like dealing with confidentiality. What you said, yeah, we also invest in trainings, especially the staff and the monitors who are used to this. CCCM is not protection, so it is part of protection mainstreaming, but it's not like dealing with sensitive cases, DBB, and so on. So what that means is that the staff and the monitors who are dealing with the any CFM related, then they're trained on referrals, and there is that direct linkage with the colleagues from protection cluster for follow-up. Also, language is very important. I just wanted to highlight that people are aware of what you're doing. So whether it means translating, or like what we've done in the case of Somalia, we have like a video recording, which normally is played to even communities on how to do CFM that is done in the local language. So to just make sure that people are aware of the process and what happens when it comes to CFM and how that data is, when data is collected, what happens and what feedback. I mean, the whole process of the feedback, including closing the feedback loop. And then I wanted just to weigh in one point, I hope real quick, on terms of collective feedback system. I think someone asked a very good question, what do we really mean? In our case, and being practical, we've not done this, but what we've been discussing is how could we make, for example, one-stop shop at the site level where we have focal points from every other cluster or sector, and they're able to give real-time feedback. It may sound idealistic, but whereby, for example, the community center, even at the information center, or even just a CFM one-stop shop whereby people can get immediate feedback based on the data that we have, just linking that with the data we have. Those are just final thoughts I wanted to share. Over to you.
Thanks so much, James. Elda, we're going to wrap it up really quickly. So if you can go 30 seconds, please.
Okay. Yeah, just to feed into the conversation, just briefly about language, a lesson learned for Linha Verde has been that, with our service being available in 14 languages and this whole thing of data cleaning and making sure that the issues are not lost in translation, making sure that our operators capture the issues, even for our team in terms of cleaning data, it was kind of difficult to see in the different 14 languages that were translated to Portuguese, how certain issues were translated to this language and how they were brought forward, and how we can continue to convey these issues forward in a way that would not be lost. The importance of the issues would not be lost. I think that was an important lesson learned to us in ensuring that training across these languages and emphasis of the issues and how also these issues can be communicated to the people in the community was super, super important for our operators, and learning that and being able to convey that to much higher levels was a breakthrough. Over.
Super. Thanks very much, Elda. Claire, did you want to come in, or Eva or Charlie, with like 30-second last words? Are you okay, or anything, Claire?
I'll go very quickly. 2 things. Just when you're thinking about design for the margins and make inclusion a starting point rather than an afterthought, because that's going to improve accessibility for everyone. And consider always the purpose of everything that you're collecting, because AAP should be around informing programming, not informing reporting. Thank you.
Great. Thanks very much. Ava, Charlie, are you okay, or is there any last words that you want? Wonderful. Thank you so much. Huge thanks to our panelists, and I'm sorry we're running a little bit over, but I do want to show you the Mentimeter that we have, because there were a lot of great responses that came up, and we will be putting that on the website, the event page, so that you can look at those responses a bit more. But a few things that I saw in there were calls for, we need leadership at different levels, we need common guidance and tools, which is some of the stuff we talked about, although maybe we have enough tools, but more that guidance about how to find them and use them. Some suggestions around getting donors to make it happen, but others also saying that really it's about us making sure that we see the value of it, because as many have mentioned, it's about improving programs and making sure that we're putting people at the center. Also about training staff, kind of James, as you had mentioned, and making sure that we've got the right staff in place to be able to analyze that data and turn it into something that decision makers can use. Ensuring that our systems have the right confidentiality so people trust them, but also really asking for feedback and not just being passive and saying, oh, here's a system you can use, but really going out and talking to people, getting that informal feedback and making sure that we have multiple systems to be able to collect all that feedback and complaints. And then really, I think that point about following up is a really important point of it all. I mean, I think this panel today, as well as the audience, you've had so many suggestions and ideas and experiences that you've shared. So a huge thanks for all that engagement. And I know some people have asked if you can save the chat, and I see why. I will be doing it. At the bottom of your chat where you can be typing, if you go to the 3 dots on the right-hand side, you can save the chat, and then you can also find it in your, wherever it is on your computer, so you can save that for later. I think it's been an excellent conversation about why it's so important that we have data standardization so that we're able to share data, that we're able to identify where feedback and complaints are being made, how we can respond to them. But I think the really important point also about we must only collect data if we're going to use it in a serious way. Don't collect data just for the sake of it. And I think there were some points around, donors sometimes ask us for data, but that may not be what we need in order for decision makers to be able to make the appropriate changes in programs. Also really important to make sure that we engage communities as we're designing these collective systems and making sure that we've got multiple entry points for people to be able to provide their feedback and complaints, but also making sure that they're involved in the evaluation of it so that we're really being able to adapt and change so that if we see one of our systems is not working well, that we are able to find a better way of doing it. I think the tools that will be coming out, the logbook template that's going to be there for feedback, I think there's lots of interest from people. And I know that Ben had put his email address in the chat, Ben Noble. So if you are interested in helping to test the feedback logbook, please do. And also share any experiences that you have. I think the opportunity, Charlie, that you mentioned with the way the ISC is being restructured to really see how we can be coming together to be looking much more at being better at collectively pushing these complaints and feedback mechanisms and the all-important response. I think it's really also that we don't just need to have specialists, but figure out how we signpost these different tools and really getting everyone to understand that they will be getting feedback and they need to be capturing that and making sure it's passed on to the right individuals so that we can have the responses that we need. So much more was said, and I apologize, I can't summarize everything, but I think huge thanks to all of you. And definitely we can make sure you save the chat and look at the Q&A even after we finish. We will have a recording of the event, both in audio and podcast, video and audio only, or a podcast format, hopefully later today or in the coming days. So you can hear all of this one more time. We are also having a quick evaluation of today's event, so please feel free to fill that in. Vaughn has put the link in there, so just take a couple of minutes to do that, please. We would be most appreciative. Join us next week on Wednesday at 11 o'clock, Wednesday the 11th at 11 a.m. Geneva time. And that's an in-person hybrid event, so online or in person, where we will be looking at accountability to affected populations, a leadership commitment, which was one of those things that was flagged in the Menti about where we really need it. So finding that leadership is really important. Huge thanks to all of you in the audience. Thanks to our great panel. I think you provided us with excellent examples and advice of what we should be doing with collective CFMs. Thanks to Ellen, our captioner, and to PHAP and everyone in the ISC that has been involved in making this happen today. And apologies for going over again, but you had so many great questions and so much great insights today that I thought it was important that we could hear from all our panelists and get a bit of a summary. So with that, I wish you a very good rest of the day and look forward to hopefully seeing you in person or virtually next Wednesday on our third session for HNPW. Have a good day.